Hello everyone, myself Navya, Assistant Professor, Department of Community Health Nursing, Yenepoya Nursing College. Today, in this session, we are going to learn about levels of prevention. Learning objective for these sessions are: learners will be able to define prevention, discuss the importance of illness prevention in healthcare, list down the different levels of prevention, differentiate between levels of prevention, discuss the role of health professionals in implementing each levels of prevention. Definition says that according to John M. Last, prevention is action aimed at eradicating, eliminating or minimizing the impact of diseases and disability. Importance of illness prevention: extend the life expectancy. That means when people will be healthy, they can live life longer. Reduces the healthcare cost. When people will less spend for hospital admissions, their amount which they are spending for hospital will be reduced. Improve the productivity and well-being. When the people are healthy, they can perform better and production will be increases. Protecting the vulnerable populations such as pregnant mother, lactating mother, children and elderly. When we focus on vulnerable population, we can prevent a major impact on the society. Strengthening public health and community resilience. Community infrastructure improvement or all the facilities, social structure improvement will help the community resilience. Do you know we can prevent the diseases in different levels? Major levels of preventions are primordial prevention, primary prevention, secondary prevention and tertiary prevention. Primordial prevention. Primordial prevention is the prevention of development of risk factor in population where they have not yet appeared by adopting healthy lifestyle and modifying social and environmental condition. Major aim of the primordial prevention is health education and mass education. Primordial prevention is relatively new concept. It is receiving special attention in the prevention of chronic diseases. Many adult health issues such as obesity, hypertension often begin in childhood. Example of such habit include smoking, eating pattern and physical activity level. Health choices made during childhood can prevent serious diseases later in life. Primordial prevention begins in childhood when health risk behavior begins. Parents, teachers, peer groups are important in imparting health education to children. Government strategy for primordial prevention. Health policies and legislation. For example, banning smoking in public places can prevent future complications such as lung diseases. School and community programs. Our government program is mainly focusing on school is midday meal program that helps to balance the nutritional status of children. Environmental social measures. For example, government can make a strategy like safe park and exercise path that will improve or motivate the public to do exercises in the particular places meant for them. Maternal and child health program. This maternal and child health program will help to prevent the maternal and infant mortality rate. Next, we will learn about primary prevention. Primary prevention refers to action taken before a disease or health problems occurs with the goal of reducing risk factors and preventing the onset of illness. Measures of primary preventions are health promotions and specific protection. Coming to health promotion, it is a process of enabling people to gain a control over factor that affects their health and improve overall well-being. Major aim of this health promotion is strengthen the host and empower people to improve health. Health promotion interventions, mainly providing health education to improve health, for example, anti-tobacco awareness program, environmental modifications, changing the surrounding to promote health, Example, providing safe drinking water and proper sanitation. Behavioral changes that will encourage the community members to practice healthy habits. Example, hand washing practices to prevent infections. Lifestyle changes, long-term adjustment in daily routine. For example, regular exercises, stress management will help to improve the status of community. Nutrition intervention is promote the healthy diet. Example, supplementation of iron and folic acid to prevent anemia. Next comes to specific protection. It refers to measure taken to prevent individual or group from developing particular diseases by targeting specific causes or risk factor. It acts before the onset of diseases and focus on protecting against specific health threats. Major government strategy in primary prevention is universal immunization program that is mainly focusing on small children and pregnant mother. National Nutrition Anemia Control Program that is mainly focusing on adolescent, pregnant mother and lactating mother. Here major activity is distribution of iron and folic acid. National TB elimination programs mainly focusing on screening the TB patients and dot therapy. Dot therapy nothing but direct observation therapy by Anganwadi workers, staff nurses or primary health officers. Swachh Bharat strategy. Swachh Bharat strategy mainly focusing on cleanliness of the surrounding, building a toilet facility where the especially in rural areas. Janani Suraksha Yojana schemes also implemented for as a primary prevention mainly to prevent the infant and maternal mortality. Next comes to secondary prevention. Secondary prevention is action taken to detect the diseases in early stage and to apply appropriate intervention to limit its progress and prevent disability. Objectives of secondary preventions: early diagnosis, detecting the diseases before it becomes serious or spreads. Prompt treatment, immediate management to prevent the complications. Third objective is prevent spread of diseases, especially in infectious condition. Fourth objective is restore health. It will help individual return to normal life quickly. Government strategy for secondary prevention is screening program, especially cancer detections, tuberculosis detection. This is a major problem health issues seen in India. Early diagnosis and program, prompt treatment facility, health checkup camps and outreach services, awareness and education is the strategy for secondary prevention. Tertiary prevention. Tertiary prevention comprises all the measures available to reduce or limit impairment and disability, to prevent complication and to promote the patient's adjustment to incurable condition and maximum rehabilitation. Major objective of tertiary prevention: prevent further complication of diseases, reduce the disability and sufferings, rehabilitate a patient socially, mentally and physically, and improve the quality of life. The word meaning of disability limitation is aim to stop or slow down the progress of diseases and prevent further disability. Example, controlling blood sugars in diabetes to prevent blindness, kidney failure or neuropathy. Controlling high blood pressure to prevent a stroke. Rehabilitation. Word meaning of rehabilitation nothing but restore the individual to maximum possible physical, mental, social and occasional ability after a disability has already occurred. Types of rehabilitation: medical rehabilitation such as physiotherapy, speech therapy. Social rehabilitation is social support, social counseling. Vocational rehabilitation nothing but job training. Psychological rehabilitation is providing counseling, stress management. Government strategy for tertiary prevention: chronic disease management. Hypertension, diabetes is a major problems which dealing in primary health centers. Community diseases care and rehabilitations. Dot therapy, leprosy therapy is one of the program which implementing in primary health centers as a tertiary preventions. Maternal and child health disability care, mainly focusing on birth difficulties. Disability and rehabilitation schemes, mainly focusing on medical and economical, preventing medical complications and providing economical benefits. Mental health rehabilitation is providing counseling and psychotherapy to prevent a complication in future. Differentiate between the levels of prevention. First levels of prevention is primordial preventions. Main aim is prevent the emergency of risk factor, mainly focusing on policy and environment. Example, anti-tobacco laws promoting healthy habits in children. Second level is primary preventions. Main aim is prevent onset of diseases, focusing on health promotion and specific protections. Main example is vaccination, mosquito nets, safe sex. Secondary prevention, main aim is detect and treat early, focusing on screening and early diagnosis, cancer screening and blood pressure check. Tertiary prevention, limit complication and disability is the main aim and focusing on treatment and rehabilitation. Example, physiotherapy, insulin therapy, cardiac rehabilitation. Role of nurses in levels of prevention. Nurse educate patient on healthy lifestyle. They promote regular exercise and nutrition. Nurse encourage personal hygiene and sanitation. They administer vaccine for disease prevention. Nurses perform screening for early detection. They provide counseling on safe practice. Nurse monitor patient for risk factors. They support community awareness health programs. Nurses assist in family planning education. They guide rehabilitation to prevent disability. As a conclusion, the level of prevention provides a complete approach to healthcare, from stopping risk factor before they appear to preventing diseases, detecting it early, reducing complications and avoiding unnecessary treatment. Together, they highlight the importance of promoting health and improving the quality of life at every stages. Hope this session will be useful for the learners.